Welcome to the Holistic Plastic Surgery Show, where we dive deep into the hottest trends in health, beauty, and cosmetic treatments. I'm Dr. Anthony Youn, America's holistic plastic surgeon. Have you ever wanted to look as good as your favorite celebrities? We see them on TV with their impossibly smooth skin, perfect pouty lips, and incredibly shapely figures. Is it fair for us to compare ourselves to Hollywood actors and actresses? And how does social media play into all of this? Well, on a whole, celebrities have always denied going under the knife. But on this episode of the Holistic Plastic Surgery Show, we're going to get to the bottom of how celebrities look so good. Is it real or is it plastic? And how can you get Angelina Jolie's plump lips, Halle Berry's ample breasts, Taylor Swift's smooth legs, and Beyonce's shapely behind? So let's get started. My guest this week began his surgical training at the Philadelphia College of Osteopathic Medicine and Temple University. He completed residencies at the University of Medicine and Dentistry of New Jersey, Temple University, and Cooper Hospital. He then traveled to Beverly Hills, California to complete a cosmetic surgery fellowship. My guest is Chief of Plastic Surgery at Kennedy Health Hospitals and serves as a clinical assistant professor in the Department of Surgery at UMD-NJ. He is the past president of the American College of Osteopathic Surgeons Plastic Surgery Division. His practice, Davis Cosmetic Surgery, is located in Cherry Hill, New Jersey, and Philadelphia, Pennsylvania. My guest has been featured on The Doctors, The Dr. Oz Show, Good Morning America, and many other programs. I'd like to welcome my good friend, board-certified plastic surgeon, Dr. Stephen Davis, to the Holistic Plastic Surgery Show. Well, thank you so much for coming on the show.
It's great to be here, Tony.
All right,
really enjoy it.
Let's start by talking a little bit about your practice. Can you tell me about the practice, the types of patients that you see, and the treatments and procedures that you do in your office?
Yeah, I'm a board-certified plastic surgeon, and I really enjoy doing a lot of cosmetic plastic surgery, and it kind of involves everything from facial things to body work. I really have, I guess, developed over the years, much like yourself, an attraction for patients that want to come in and really talk about things. Aside from just running right into the operating room and doing the surgery, it is more of a holistic approach to really understanding why they want to do these procedures.
That's good. And so the types of things, I guess, what's popular in your practice right now?
The most popular thing right now is probably some sort of body contouring. Everybody's getting ready because it's the summertime of the year here, and everybody really wants to do something that's going to make them look better at the beach. So I think anything from breast implants to cool sculpting or liposuctioning. And I know with you, I'm not so sure if everybody likes this mommy makeover, but that seems to be the hottest thing right now in my practice.
And, you know, one thing that I have followed you over the last several years is that you have been really on the forefront of talking about celebrities, social media, and plastic surgery. And, you know, I talk to my patients, and we tend to, as a society, we tend to put celebrities on this pedestal. And we tend to assume that they look this way kind of naturally. And so you kind of see, okay, you know, patients will come in and say, you know, I want to look as good as Jennifer Aniston or Kim Kardashian or Halle Berry and all these celebrities. Do you think that these celebrities looking like they do, does that fuel people to have plastic surgery? And have you seen that in your practice?
It's a great question. It definitely starts the engine going for them. So they may see somebody that they resonate with, and they may have loved that individual in the movies for years. Mm-hmm. And then they'll come in and say, I really love Halle Berry. I really love the way she looks. I like the way she was portrayed in a certain movie. Do you think I can get her breasts? Do you think I can get her appearance, her skin, things like that? And I think what's so important and so incumbent upon us and our jobs is to really talk with them and try to make them understand I love that they bring these people up and that they may even bring photos, but it's very important for them to understand what the limitations may be. But them bringing those photos in and naming those celebrities at least gives us, you and I, a sense of what their aesthetics are, so that we know if they. I'll never forget. I had this African American woman come in years ago, and she brought a picture in of Michelle Pfeiffer's nose. And we were going to do a rhinoplasty on her. And I saw her in consultation first time. Second time, she came in with pictures of celebrities that she wanted. And she may have had 10 separate pictures of Michelle Pfeiffer. And I said, listen, I get that that's the aesthetic values that you're going for, but you've got an African-American nose. I'm not sure I'm going to be able to make that. And even if I could, it probably wouldn't match the rest of your face. So I think it's just good to be able to talk about all those things with people.
I mean, do you think that it's fair then, in general, for our patients and for quote-unquote regular people to compare themselves to celebrities? That's the other thing that I see is I have patients that say, no matter what I do, why can't I look like this celebrity? Or, how is it that this celebrity looks so good? And is that possible for a quote-unquote ordinary person like myself? Is it fair for us to compare ourselves to them?
That's a great question. I mean, I guess from a realistic expectation standpoint, probably not. But where I was going with my line of thinking is kind of like, and I would love to ask you how you answer those questions yourself, but I guess I tend to want to understand what the picture they're hanging on the refrigerator door of that person. I would like to know who who they're trying to strive to look like. Because it does help us discuss everything. What about their diet? What about their, physical therapy or their exercise regimen? How do you normally go about answering that if they come in with?
Yeah, I mean, so for me, I think it depends. So number one, I don't think that it's fair for any of us to compare ourselves to celebrities, because really, first thing is that the job of a lot of celebrities is to look good. You and I, we operate, we have families, we have businesses that we run. And
right.
Yeah, if I had all day to work out and I had a personal trainer and a chef and all these and a nutritionist, then I would probably look better than I do. But and we're people who are in privileged areas and that we're physicians, and we even have more potential resources than the average patient who may be more of a middle class type of an income. So the way I guess I answer it is no, it's not fair, I think, for most people to compare themselves. And there's all this airbrushing and makeup and all that can make a big difference.
Yeah, that's very true. I mean, when they bring in those type of airbrush photos, I definitely make sure they understand that that's part of what they're seeing that's so great. But my take on it or my bent on it is maybe a little different, because I do think I'll give you another analogy. I'm taking guitar lessons, Tony. Mm-hmm. I really want to play like Eric Clapton, but the chance of that happening is really slim to none. However, I went out and bought the same guitar he's got. I'm trying to play the chords and the songs and the things. So it's unrealistic to think that I'm going to get there, but it does motivate me to try to take the lessons and to practice. So if I kind of extrapolate that out, these patients that maybe come in for all this body liposuctioning, maybe they will go to the gym more frequently. Maybe they will not eat pizza 3 or 4 nights a week, and heading in that direction, I guess, is my way of looking at it.
I think that's a good point, though. I do think that, in general, a lot of these celebrities that look so good, for them to look the way they do, they have to lead a certain type of life. I mean, you can't sit at home, not exercise, binge on bad food, and find that you're going to look great. And interestingly enough, I think that you can, my experience is that you can do that when you're in your 20s. And we see these celebrities who are partying, they're in their 20s, and you see the morning after photos where they look terrible, and then they're on the red carpet later that night and they look perfect.
And they look great.
You can do that when you're in your 20s, but heck, when you hit 30 and 40, it doesn't work that way. And I think that that's what we see with some of these celebrities too. As they get a little bit older, they don't quite look as good as they used to. And a lot of that, I think, doesn't matter who your makeup artist is and stuff,
that's right.
You're showing your lifestyle.
You're right. And I'll tell you, athletes are 100% on board with that, because I heard an interview with LeBron James, and he said Kobe really taught him when they were on the Olympic team together about as you're aging, listen to me, you can't do what these younger guys are doing every night. You got to really watch what you're eating. You got to watch what you're drinking, and just realize as you're getting older, if you want to stay relevant, you're going to still have to do certain things that are a little different.
Yeah, so I think you're right. This discipline, even in, let's say, looking our best, you do need discipline to do that. And
It's true.
As much as celebrities have a lot more health than the average person, and you and I, they still have to have that discipline if they're going to keep those looks as they go into their 30s, 40s, and 50s.
Well, I know, and I'm sure you do the same thing. I make sure that the patients know that what I'm doing is a way of altering the way they look today, and they're going to continue to age from this point of the operation forward. So why not protect the investment? If we're doing a facelift, I definitely think sun screens and topical application of creams and things like that to maintain that look and to really protect their investment is very important to review. So similarly with liposuction or a tummy tuck, I think making sure they know now you really want to continue to watch what you're eating, you want to exercise appropriately, etc.
Now, you've treated a lot of celebrities in the past. Your office is just outside of New York and Philadelphia, so you do see a lot of people. How have celebrities, how do they act differently compared to, let's say, a patient who's a teacher or a nurse or a doctor? Do they act differently to you? Do they have different expectations? Are they harder to deal with?
For the most part, I would say they're usually easier to deal with because they understand what's going into doing this, and they're very, very motivated to get back to work, to get back to whatever they were getting set to do. So they are very, very regimented. They come in, I can just tell you off the top of my head, a couple of men that I've operated on were treating it literally like I was their personal trainer. And they were very serious. They came with a notebook. And they were very didactic about what they had to do to make sure that this was going to work out fine. And I've done the same thing with other celebrities that were women. And it actually taught me a great lesson, Tony. It taught me a great lesson. These patients are literally becoming a partner in their results. And they made it very clear to me that they understood that. Like it wasn't just going to be hocus pocus and they were going to look better. It was going to be, I was going to do my part of the job, but they also asked me, what can they do to make their results better or the best that they could be? Which was really great because a lot of patients kind of avoid that. A lot of patients just come in, and they think that, all right, we're going to just drop ourselves on your lap and you're going to make us look great. They actually knew that there was a part of this that they needed to participate in. And I thought that was very interesting. So I think they've actually been easier for me to deal with than others. I know there could be. How about you in your experience? Have you run into ones that were a little bit more difficult?
Yeah, I think with them, typically when you have celebrities, and here I'm in Detroit, so I don't see as many of the national celebrities as if I was in LA or in New York or even Miami. But there's definitely, I think, a higher level of confidentiality. I mean, it's always confidential, but sometimes we'll have celebrities that come in and they don't necessarily want to sit in the waiting room with everybody else. They want to get into a room right away because people might spot them. Do you find that you alter procedures at all? If it's a celebrity, do it a little bit differently, or do you pretty much do these procedures the same?
My procedures, I think I pretty much keep the same, but the way we handle, like you're saying, the ins and outs are a little different. Like I don't normally see every patient on a Sunday, but I'll come in and do suture removal or something like that for these patients. We'll clear out part of the waiting room area if we know that they're coming in with like an entourage of people. And even, some of the bigger procedures, we've actually lined things up so that at the hotel that they're going to stay in, we usually always have a room. But in a few cases, we've actually taken like the floor for them.
Really?
So they could really be completely private, bring their family if they wanted to, or anybody that was traveling with them.
Wow, wow. Yeah, I think it is definitely a different experience when you do have a celebrity. And my experience too is that they are very, very image conscious, which isn't surprising. I mean,
Right.
and whereas I think in some cases I have changed a little bit of the procedures I've done. Just one example that comes to mind is
Yeah.
our nose jobs. And back when I was in LA, we had a patient who came in to see us, and she had a rhinoplasty, a nose job, by a doctor, and they did what's called an open technique, where she had the incisions on the inside of the nose and then kind of crossing over the columella, which is this part of the nose. And they took her nasal ala down a little bit, so that she had a little scar right here at the base of each nostril. And she actually went on an audition, and the casting director saw her nose job scars, pulled her out of the line, and said that she's not right for the part. So,
oh my God.
Yeah, so that is something that did teach me a lesson. This was back, gosh, maybe almost 15 years ago when I was doing my fellowship out in Beverly Hills in LA.
Yeah.
And it taught me definitely that you have to kind of look at what the person does, what their expectations are. And yeah, I mean, if I've got a patient who's on TV or who's a model and they want to have a certain surgery that creates visible scars, I really spend a lot of time talking with them, because that may not affect so much a job on somebody who's an accountant or something like that.
Right.
But if people are taking pictures of you and it's high HD now, that could be a big
That's right. It's very true. I mean, how about with the breast augmentation, going through the axillary incision versus other things? Have you ever had like a person that did a lot of bikini or anything like that said they wanted the incision in a certain location?
For the breasts, I haven't really altered that. And I used to do a lot of transaxillary, but I don't much anymore, especially as more and more the studies are showing that the risk of capsular contracture or scar tissue is higher with that. So I haven't done those in a while. I've really, ever since the silicone implants were put back on the market in 2006, the demand I find for that procedure, and I don't put silicone implants through the armpit, has dropped to the point now where I just don't do it anymore.
See, I'm just like you with this. I have had a bikini model who is, I guess, relatively famous in that regard come in and literally try to dictate where the incision should be, how it should be done, so that in her bathing suits and bikinis or whatever, it would be a certain way. I guess that's been an issue too sometimes. So that's an interesting thing.
Well, let's get back to kind of these celebrities and their famous body parts and kind of wanting to look like you're famous, a famous celebrity. Do patients ask you to actually look like a certain celebrity? There was a television show on MTV several years ago called I Want a Famous Face. And it was about people who literally underwent multiple operations to look like celebrities like Justin Bieber. Do you get that at all much in your practice? People who say, I actually want to look just like this person?
I've never had anybody say that they really wanted to look exactly like that person. Mm-hmm. But when the conversation starts to get uncomfortable for me, and you can really tell that they're more than just liking the way that person's body part would look, they're like really having photos. They have their own mirror in their hand. Mm-hmm. I tend to decide this is probably not a great patient for me to be operating on. Yeah. Because I think it does become an unrealistic thing. And also, I try to explain to a lot of patients that come in with that drive. We've had a run of Donald Trump's wife, Melania. People have come in with, they like her cheeks, mm-hmm. and they like a certain facial structure. And I get the idea of what they're trying to portray with that full cheek and the nice jawline. But, you know, when that celebrity falls out of favor and you're stuck looking like this person for the rest of your life, that's not a great thing. So I think it is important for them to know this isn't something that's so reversible a lot of times.
Yeah, I totally agree. Okay, well, what I'd like to do is do some kind of quick hits. What I'd like to do is give you the name of a body part. Okay. And if you can tell me the celebrity who has that body part that's most requested in your office. And then if you could just give one tip of a procedure or a treatment that people can consider if they want to go in that direction. So the idea is not that you want to look like this celebrity, but, wow, I admire so-and-so's lips, and how can I get my lips to look a little more like that? And we'll do this kind of quick. So I'll give you the name of the actual body part. you can give me the celebrity name, and maybe in 2 minutes or so, the technique or procedure or whatever that you would recommend for your patients to kind of go in that direction and achieve that. Sounds good?
Gotcha.
All right, here we go. So first celebrity body part are lips. So who has the most requested lips? And is there something that patients can do and listeners and viewers can do to get those types of lips?
All right. So I'm going to give you two answers.
All right.
The most requested right now is Kylie Jenner. Kylie Jenner, across the board, is the number one person that they come in. They love her lips, and it's attracting a younger and younger crowd of patient that really understands that at the ages of 20-ish, they can really do something like have a lip augmentation. So that's my number one is Kylie Jenner.
All right.
How about you?
I would say I would agree with that.
Okay.
Yeah. And I'll give my comments after you're done here. But
okay. All right. So that's my first one. I was going to say the other one is always Angelina Jolie.
Yeah.
But my little disclaimer, if you will, she really is starting with an unbelievable set of lips to begin with. Mm-hmm. So any enhancement to those are just going to accentuate that beautiful lip. But a lot of people that really want that size that start out with a very small lip may be unrealistic. So I do use both of them also to describe things.
Good, good. So what do you recommend then for people who are interested in looking more like Kylie or like Angelina?
My go-to is Juvederm Ultra or Ultra Plus for those types of lips. Somebody that already comes in that has Angelina Jolie's size lips, I've loved Restylane Silk. Mm-hmm. I think that's a very good product. It's not going to overwhelm the lip too much, but it does do a great job at creating a very sharp border and highlight how beautiful their innate lips are.
Yeah, and I would add to yours, Scarlett Johansson. I think is a lot like Angelina Jolie in that if you look at it, they were both young actresses and they both had very full lips. So their lips are pretty much naturally they look that way.
Beautiful.
Right. I also agree with Juvederm Ultra Plus and Ultra as well as Restylane Silk. We use all three of those in my office. The one thing that I would add to that is we are now using cannulas to inject the filler into the lips, and I'm finding that we're getting a smoother and a much nicer result. So, and a safer.
So let me ask you a question. For the Cupid's bow, that area right in the middle, do you feel that you can get as sharp of a result with the cannula there?
So what I do is I'll use a cannula for the lower lip and make one tiny little poke in the corner and go all the way across with the cannula, usually maybe 2 or 3 times at the most. Then I'll go through that same poke, go through the upper lip, up to Cupid's bow on one side, up to Cupid's bow on the other side. Then I'll actually switch it to the needle and go from the middle to finish that up. So I haven't been able to, and I'm not risky. To me, I think it's too risky to just go all the way across the lip and inject it. My worry is probably just like what you said, is causing the Cupid's bow, which is the kind of the curved part of the upper lip, to flatten out. And I think that would be very hard to treat if we did that. And that's why I do the technique that I do.
I agree with you. Yeah, same.
All right. So the next one are eyes. So which celebrity has the most requested eyes? And what procedure would you recommend for people who'd like to look like that?
Okay. I'll give you this one. Emma Stone from the movie La La Land. I can't tell you the number of people that have brought in her beautiful picture of showing her eyes. I think they're gorgeous. I think people like the whole orbital rim and the eye. So it's like I try to make sure that I understand what they're looking at that they like so much. But it is the shape of the eyelid and the shape of her brow that I think makes that area look so beautiful. And I'm able to go into the next part of the question. I really enjoy injecting Botox in specific areas to basically give them the brow shape that they're looking for, so that I can either raise their brow up and arch it in a certain way, or if they want it to be a little bit more flat, I can do that as well. So I love understanding the look that they're going for. And I've also been injecting a little bit of Restylane in the underbrow area to highlight sometimes that little bit of a brow lifting that I can get by putting a little filler in, because some of the older patients, as you know, come in and they do have a little descent of that lateral brow, and I think it's also sometimes due to volume loss. So putting a little bit of filler in that area gives me a little bit more of a lift or a shape to the eye that they like.
Yeah, that's great.
How about,
I agree. I think Emma Stone, I mean, number one, she can sing. She's gorgeous. And I thought La La Land was my favorite movie of the entire year last year. So I would give that one as well. I think, part of it, though, I think with eyes is that you're kind of born with the eyes that you have. And she's very expressive with her eyes. Her eyes are proportionally a bit larger than, let's say, the average person. And so, if you've developed smaller eyes and it's just that's genetically what you've given, then there's not a lot you can do to make them look like Emma's. But just like you said, Botox, I agree with you, is a very powerful way to make just tiny little changes that can have big consequences, which can be really, really nice for patients.
Absolutely.
So, yeah. All right. Let's move to breasts. So
Okay.
the most popular cosmetic surgery last year, according to the Aesthetic Society, is breast augmentation. Who has the most requested breasts in Hollywood? And what do you recommend for those people who are looking to look that way?
So Scarlett Johansson, as you mentioned, has a very wonderful pair of breasts. Everybody loves them. For some patients, though, I think that may get to be kind of larger than they feel that would fit them properly. So over the years, as we've gone from the Pamela Anderson, if you will, or Dolly Parton-esque age, where people were really coming in for size, in my practice, I'm noticing more and more of the patients want perky, youthful, tight breasts. And to my, I don't want to say amazement, but to my surprise, Halle Berry, at the age of 50, I guess, looks unbelievable. And some patients have found some internet photos of her, not completely naked, but like with a very sheer type of a shirt. And I don't know, it must be available rather easily because multiple patients have brought the same photo in. Mm-hmm. That's the number one breast. If I had to say celebrity-wise over the past, let's say, year, I've seen that photo more than anybody else's. And they're perky, they're youthful, they're maybe like a full B, small C type of a thing, but they're like perfect breasts, the nipple and areola. So I don't know about how you're seeing things in Detroit, but for me, I'm doing a lot of periareolar lifts because either after pregnancies or just weight loss or things like that, the areola themselves have stretched out and have become a little bit more of in a dependent or a lower position. Mm-hmm. So doing a little bit of a periareolar lift as well as augmenting or adding some volume to areas, especially in the superior pole where a lot of women have lost that fullness, has been the answer to a lot of patients' concerns without just going for size.
Yeah, and I agree too. And I think that, in the past people think, oh, you have breast implants and they're going to be huge. And really, I have my patients decide what size they want to be, and I help them out, obviously, with it. But in the end, it's up to them what size. And the vast majority of them really pick sizes that are very proportional for their frame. So, all right, how about legs? Who has the most requested celebrity legs? And what would you recommend to help people go in that direction?
Right. A lot of patients bring in photos of people that perform on stage when they want to show legs. So ones that are very muscular are something like a Katy Perry, or even Beyonce before the pregnancies and everything else. But the shape and the muscularity is part of what I think a lot of people are attracted to. But I think Taylor Swift, in a couple of her videos, showed enough of the leg going up to like the hip region that allows me to talk to some of the patients when they have possibly a saddlebag, which is that out-pocketing of fat, on the lateral aspect or the outside aspect of the thigh. A lot of patients say years ago they had that exact same thigh, like a Taylor Swift. And over the years, they just developed that little softball, if you will, of fat that protrudes from the lateral aspect of the leg. And that's something that's pretty easy to remove with some liposuction. So I think in my practice, calf, ankle, knee, anterior lateral thigh, those types of things, we can really tweak very nicely with very directed liposuctioning. What do you think?
So I would agree with you that, yeah, Taylor Swift, definitely the most requested. Now, we've been actually doing a lot of sculpture in our practice, and this is a non-surgical fat-reducing device, especially for those small areas of fat and people who say, look, I'm in great shape, I work out, I exercise, I eat healthy, but I just got these stubborn areas of fat, and we've had great luck with sculpture as a way to get rid of that fat without going under the knife.
And so, we've used cool sculpting in a similar way for areas that are like little pockets around the inner knee or things like that.
Yeah.
So I agree. It's a great way of doing it non-surgically.
Yeah, and if we can avoid surgery, for me, I feel so strongly that if I can get somebody a great result and avoid surgery, then that's the way to go because, you have so much less risk that way.
You and I think exactly alike with that. So I know I always follow you with that, and I know we really think the same way with that.
Okay, so one of the fastest growing procedures out there is buttock enhancement. And there are a lot of plastic surgeons that you and I know who are on Snapchat and Instagram, and they're showing their Brazilian butt lifts. So who has the most requested derriere? And do you do procedures to help get people something close to that?
Right. So unfortunately, I'm going to name two people that you probably can think right off the top of your head that everybody would probably bring in. So the first is going to be Kim Kardashian. And the second one's going to be Nicki Minaj. Now, I got to tell you, just like I have a very positive attitude about this, because what I try to explain to them is I love that photo of Nicki Minaj that they bring in. She's got an incredibly large derriere. However, it gives me the opportunity to show them the contrast of the size of her waist in comparison to her butt. And if you take a look at anybody's really great, like before and afters, they've narrowed that person's waist so well so that it does give a better shape to the butt. And I actually do a lot of Brazilian butt lifts. Not to the extent of the size that you would think of with a Nicki Minaj or a Kim Kardashian, but I do, Tony, use it in a way. For instance, yesterday, we did liposuction of the abdomen and love handles on a patient, and then we took that fat and grafted it into her butt. She lost a bunch of weight over the past year, and the butt just became a little more saggy, just like when patients will come in and talk about their breasts, and we'll use an implant in that case. But in this particular way, we can transfer the fat, and I think it does shape the butt very beautifully if it's done properly, and it's done, again, trying to keep a certain semblance of reality in there. I think it works very well. How about you?
Yeah, no, I would agree with you. I mean, I don't do a lot of buttock enhancements, and the ones that I do are pretty conservative. And there has been some data coming out now from the plastic surgery societies showing that the buttock enhancement, like the Brazilian butt lift, may have the highest mortality rate of all the surgeries that we're doing. And so I'm definitely very cautious with that. I think that certain celebrities like Nicki Minaj, I mean, the proportions are so extreme that that's just not my thing. And I am not interested in trying to create that because it is so incredibly unnatural looking to me. And, and so it's not my thing. And those patients who say, well, this is what I want. And I say, look, I'm not into that. I'm happy to send you to some of my colleagues out in Miami who they love doing that, but not my thing.
I got you.
Well, we've been focusing a lot on women here. But how about men? Are there a few men that maybe that are brought up to you as far as ideals that patients look at?
Yeah, I'm going to even take it in a different direction, Tony. I'm going to tell you that I do have men that come in and say they don't want to look like certain people. So I can tell you right off the bat, when patients come in and the first thing out of their mouth is something like, "What happened to Al Pacino?" You know, when he was in a certain movie, I think about the devil or something like that. There was a movie that they bring up, or the singer, which them probably they always tell you about, Kenny Rogers.
Yeah.
Did they ever tell you about Kenny Rogers' eyes and his face?
Oh, yeah.
So I definitely know who they don't want to look like. But people that, it's interesting. A lot of the guys that they come in and ask about, I don't really think have had a lot of work done. They just have a very sharp jawline.
Yep.
And they may have had something done maybe Botox wise so that their forehead and their skin and things like that kind of look better. But overall, people like Bradley Cooper may have had a little something done. But I mean, I think when they bring him in, they just like his overall appearance, the sharpness of his jawline. George Clooney, I think, has run his course. I mean, he's a very handsome guy, but I don't think he necessarily looks overly young or tight or anything that where you would say he's had plastic surgery.
Well, he did famously say that he had, he said he had ironing of his scrotum at one point.
I remember that.
And funny, like tabloids picked that up and actually said, yeah, he actually admitted having plastic surgery. He had his scrotum ironed. It's like, what? And obviously he was joking at the time, but there are some people who actually thought he was serious.
I know. It's very funny. It's very funny. But no, I think the guys that come in nowadays, I don't know about your practice, but a lot of crow's feet things, things about the eyes. And I guess with the new product, Kybella, which is the product that's deoxycholic acid, which dissolves fat cells, it was FDA approved for the area underneath the neck.
Yep.
And the double chin area. And I'll tell you, they focused a lot of their advertising towards guys, and a lot of men have come in. I'll tell you a very interesting, quick little thing. We did this on a gentleman about 4 to 6 weeks ago. The only thing he was interested in was fitting into his old shirts because his neck just got too big for his entire wardrobe of clothing. So all we did is do some Kybella, and I thought he definitely needed another session or two. He said, no, his collar's fitting fine. I'm done.
Oh,
so
that's
said,
great.
Okay, that's good.
Yeah, that's great. Yeah, I would add to that. I agree with you. I think that the sculpted jawline is what a lot of men look for. I have put chin implants in men. That's the only actual implant that I put short of fat and injectables. And I think that has helped a lot of men to create a much nicer jawline and sculpted look. I have done some filler into the chin for some men as well, which I think works really well too. But really for men, I agree. A lot of it's about minimally invasive, less invasive, no visible scars. There still, I think, is much more of a stigma for men in the workplace to have had work done, where the guys will rib them and stuff like that. So for most men, some exceptions, obviously, it's focusing on those procedures that have either no scars or hidden scars. And performing those types of procedures on them.
Yeah, just like you mentioned with the cool sculpting with the sculpture, we've done a lot of cool sculpting on men because of that reason by itself. There's no downtime. They don't have to have anybody bring them to the office to get treated. It's that they go back to the gym or they go back to work immediately. So that seems to fit right in the wheelhouse of most men.
Well, his name is Dr. Stephen Davis. He's a board-certified plastic surgeon. He has practices in New Jersey as well as in Philadelphia. His website is daviscps.com. That's daviscps.com. He performs all sorts of cosmetic procedures, surgical as well as non-surgical procedures. So at the end of every show, I always ask my guests if they could give our listeners and our viewers one take-home point, one take-home point for them to think about as we finish the show. What would that be from Dr. Stephen Davis, board-certified plastic surgeon, Cherry Hill, New Jersey?
It was great being with you, Tony. I really love your show. I love everything you do. And here's my take-home point. Thank you so much for letting me be on the show. My take-home point is everyone probably has something that they know they would like to improve, be it a physical body part, be it something about schooling or education. And I just want to be the person to say that it's very important for you to try to address that and try to do everything in your power to make that aspect as perfect as it can be for you, because I think that will definitely make you feel better about yourself and moving forward in your life. If that's been an obstacle or a barrier for anything, just trying to like champion that and go above that will change all different things in your life. So take that for what it's worth. But it was great being on the show with you. You have a great show. Thanks for everything.
Thank you. So his name is Dr. Stephen Davis. He's a board-certified plastic surgeon with offices in New Jersey and Philadelphia. His website is daviscps.com. That's daviscps.com. It was a lot of fun. Thank you so much for coming on.
A lot of fun.
All right, I'm Dr.
I hope to do it again.
I'm Dr. Anthony Youn, America's holistic plastic surgeon. We will see you next week. Thank you, everybody.
Bye-bye.
Do you want to look 10 years younger without having surgery? Well, my best-selling book, The Age Fix, will tell you how. I spent the past 17 years learning the secrets to turning back the clock and have written all the best of these secrets in this book. This includes the Age Fix diet, simple changes to what you eat that can make a huge difference in your appearance. I'll share with you a simple skincare routine to keep aging and wrinkles at bay. And I'll share with you the best secrets to treat every single beauty and aging problem there is, from age spots to wrinkles, saggy skin to bad breath, saddlebags to hair loss. And almost all of these can be effectively treated without surgery. So are you ready to turn back the clock and kick Father Time's backside? If so, check out The Age Fix. Now, if you purchase it on my website, dryoun.com, you'll get over $10 off the cover price, free shipping, and you'll receive several free gifts, including a bonus chapter that you can only get by purchasing the book there. Thank you for making The Age Fix such a huge success.